Hello everyone, today is Tuesday, July the 15th. I am 18 days post-op. This is exactly 1 week from the last time I posted a video. A lot has changed this week. I'll start by saying this. This video, I plan on making a longer video as opposed to a 3-minute. I think my last one was 6 or 7 minutes. This one will be much longer. I want to talk about not only where I've been and how far I've come so far, but what I expect going forward over the next few weeks. So that being said, I'm just going to go ahead and get started. There are good days and there are bad days. Up until yesterday, I'd had nothing but good days with the exception of the first day after surgery when the nerve block wore off. Yesterday was a bad day. I woke up and there was just this constant dull pain in the shoulder socket itself, and it was kind of strange. It was, here, I'll just show you the incisions as well. Doing good. They all look fairly decent. This one hurts the most, and then if I flip around to the back, that one actually has the biggest divot. It's the best way I can describe it. I don't know if I can capture that very well on the camera, but there's a divot where the incision is. I don't know what that means, if it means anything, but in any case, that one hurts the most. When the shoulder hurt yesterday, it hurt right on the top, right here. And it was very, very tender to the touch. Even doing this put me in serious pain. So all I did yesterday was relax, rest on the couch. I put a heating pad on it. My personal belief is if I put the heating pad on it, it increases blood flow to the area. If it increases blood flow to the area, that's nutrients and all that other stuff, it should aid in the healing process. I'm not looking to get better in 2 weeks. I know that's not going to happen. But I figure if I can do any little thing to help it, maybe it'll knock off, a day or an hour, or it'll ease the pain. Going forward from here, I'm not wearing the sling because I was just actually trying to get some cardio in. I haven't been doing anything but sitting on the couch and eating and watching television, so I've put on a couple pounds. I'm trying to counteract that by doing a little bit of workout here. The bicycle is great. Stationary bike is fantastic. I didn't adjust the seat properly yesterday, so when I sat down on it, it dropped, and I think that contributed to my shoulder hurting a little bit, but it was hurting long before that. This workout room here is where I plan on doing any and all future exercises for my shoulder, and cardio and anything else, little free weights in the back there. My wife will actually be running her first marathon in November, so that's coming up here in, 5 short months. She'll be running a marathon. That's almost exactly a year since she started running. She started last November really getting into the exercising and working out and going out and going running, and she absolutely loves it. She's going to start doing that. So I figure if she can start in this room and in a year run a marathon, this is a great place for me to be, to do cardio, to do free weights. She's got a yoga mat, so eventually when I have to lay down and do some stretches and other workouts from physical therapy, which I know I'm going to have to do, this will be a great place to get that done. Here's what I expect. Week 3, less and less pain. The incisions should heal up. Eventually those steri strips will fall off. She said just let them fall off in the shower. I've watched other people post, and they said that it had been 10, 12, 13 days since they had them put on, and they were still sitting on there. So I will probably take them off at the 2-week point of them being on, which will be exactly a week from today. If they haven't fallen off by then, I'll take them off, but I'll try to let it run its course. Week 4, the 1-month mark, I really don't foresee a whole lot different from week 3, other than the physical therapy will have gotten more and more, and I will be stretching more, and I'm sure I'll be hurting more. 6 weeks out, sling comes off. At that point, I expect fully to have, the bicep motions. I'm doing a few pendulums where you just kind of let the arm hang and move it back and forth. I'm doing a few of those. The wrist movement, the in and out like this, nothing hurts the shoulder. So at the 6-week point, I expect to be doing all those things with no pain whatsoever. 8 weeks, I don't know. I guess at 8 weeks, I expect to be really fully stretching. I hope that I get some external rotation. As you can see here, I probably get about, maybe 60 degrees of external rotation on my right arm, my uninjured arm. On my left one, I expect to get I don't know, anywhere between 20 and 45 when it's all said and done. So at the 8-week mark, I expect to get maybe 5 or 10 degrees of external rotation. I'll be happy with 5. I'll be ecstatic if I get 10. At the 12-week mark, I anticipate 10 to 15. If I get anything over 15 before 12 weeks, I will be incredibly surprised. I don't foresee that happening, but that would be great. 16 weeks, 12 weeks will put me at September 19th. And 16 weeks, I actually haven't even done that yet. I don't even know when that will be. But 4 months out, let's just call it October, end of October. I expect to be basically back to doing normal things. Now, I understand that there will be weight restrictions, and I get that. But all those weight restrictions aside, I anticipate being able to finally mow the yard again, being able to carry in groceries, just do everyday activities, wash my hair, because at the time being, I can't do anything. I mean, it's entirely, the whole right side is tough to wash when you can only use your right hand to do it. If you want a fun little game, try washing your right armpit with your right hand or your left armpit with your left hand. I hope to be washing my hair by week 12 with both hands. All of these expectations are all based off a video series that I watched. I actually found somebody who had gone through actually a much more involved procedure than what I had. I had just standard Bankart lesion repair. It was 270 degrees of repair, but it was just the Bankart lesion, the cartilage, and sewing it back to the glenoid. The individual I watched, and I'll give you a shout out, it was Hello7029. He went through it in October. That was when his first video was posted, and he was an MMA fighter. Now, he never did get back to fighting, at least according to his videos, he didn't. But he posted a video a week, and those have been incredibly inspirational to me. Not only to look at where I am versus where he is or was, but to know what to expect down the road and what limitations he had during his recovery process, and kind of what he ran into, what he was told by his doctor. It being 3 years ago, things I'm sure have changed a little bit, but probably not too much. He had also a shoulder socket tightening procedure done and a remplissage, where they basically anchored the tendon directly to the head of the humerus. So his was a little more involved, okay, much more involved than mine, but he had a lot of stiffness in the joint afterwards. So he actually had pulley systems and whatnot. Watching those videos were great for me. The one thing he said, and I can't remember which one it was, I think it was 6 or 8 weeks out, he basically in his video was sitting at his high school track, and he was going to try to run a mile, and he only ended up being able to do a quarter of a mile. But before he ran, he basically said, quit making excuses. And that really resonated with me last night when I watched it. I'm sitting on the couch, you know, I had just eaten some pizza for dinner, and I'm watching whatever's on television. And I was flipping through my phone, and I came across this video series, so I shut the TV off and actually watched it on my phone. And he had said, you know, quit making excuses. Get out there, exercise. It makes you feel better. You might feel like crap at the first 10 minutes or so, but you're going to feel better afterwards. The endorphins from exercising kick in, and they make you happy, really. So I said, you know what, that's a great point. Why haven't I been doing anything? If I continue to go down the path that I'm going down, I'm just going to sit on the couch and gain weight and be a huge blob at week 6 and week 8. So I said, you know what, starting tomorrow, meaning today, I'm going to get up and I'm actually going to try to do some cardio. And I did. Today I rode the bike for 30 minutes. I actually went 6.2 miles, which was a 10K, so I was happy with that. It took a little bit getting used to the seat on that thing. I'm not a huge fan of the seat, but that aside, the bike is great. It's got this little built-in fan thing, and I also brought in another fan. I've got a television here set up, so it really is kind of like a home gym. But I did 30 minutes of the bicycle, and I also did some free weights. I only did them with the good arm, but low weight, it only goes up to 8 pounds. Low weight, high reps. I did 30 reps of every exercise that I did. I did some curls, some tricep extensions, some shoulder lifts, some shoulder presses, some, I don't know, I call them lawn mowers, where I just bend over and pull back to work my back muscles. I did that for, like I said, 40 minutes, and I actually feel fantastic. The shoulder doesn't hurt at all. I really thought it was going to be sore just from riding the bicycle, even though it's very, very little movement, especially over on that side. But nothing. I feel great. It almost looks like nothing has happened to me. But I know that come the end of my 6 weeks, when I can finally get out of that sling, there's going to be a huge difference between side. I mean, there already is a big difference between the muscle structure on the operated side and the muscle structure on the unoperated side. All in all, what I feel is fantastic. I feel great. I feel good that I got to work out. I feel good that I'm posting the video. I feel good that I've been able to watch somebody else go through an entire process. He actually posted a 10-month video and showed how he had almost full range of motion back. Now, it is going to be tight when you get to the top on either side, I get that, but it was great to be able to see a progression. And I've reached out to him. I hope that he gets back in touch with me and we can exchange some dialogue. I'm sure I'll have a million questions going down the road, but it's nice to have that inspiration. And if nothing else, I could just watch his videos over and over again when I get to those points in my recovery. As I said at the beginning, this video was going to be longer. I wanted to explain kind of where I am, but also where I expect to be at each week 6, week 8, etc. I don't expect to be fully 100% back to normal, like nothing had ever happened, until a full year. And I say that because I don't want to set the lofty expectation or the lofty goal at week 23. I'm going to be back to normal. Just before my 6 months, I'm going to be, great. I'm going to be able to go kayaking and hunting and all that other stuff. I don't want to do that to myself, because then I'll be disappointed when that time comes and I can't do it. So, at week 52 is when I expect to be back to 100% or close to 100%. I plan on managing expectations, but at the same time, I want to set definitive goals so that I can actually achieve those milestones. And I can track my own progress and share that with you as well. My goal today was to work out, and I did, like I said, a 40-minute workout. It wasn't much, but I haven't worked out since high school, so you're talking almost 10 years since I've actually gotten up and worked out hard. So I was happy to be able to get on a bicycle and ride for 6 miles, even though it's a stationary bicycle. I was happy to get on and ride for 6 miles and actually do some free weight work with my good arm. So to conclude, day 18 or week 2.5, however you want to see it, I'm doing fantastic. There are good days and there are bad days. Yesterday was a bad day. I didn't do anything. Today is actually a really good day. It feels fantastic. I was able to get up and move around and do some chores and actually exercise a little bit to get some cardio in so I don't turn into a blob come week 6 or week 8. Day 18, week 2.5. There are good days and there are bad days. Yesterday was a bad day, today was a good day. Going forward, I hope they're all good days, but realistically, I know that that might not happen. I plan to manage the pain as best I can when there is pain, and take advantage of the days where I'm painless, or almost painless. I said in an earlier video that I was sneezing a lot. I still am. I talked to my sister. She said it has something to do with the anesthesia. I looked it up. She's actually right. 1/3 of the individuals who are put under heavy sedation for operations or surgical procedures, when they come out, they have sneezing fits, and it might last up to a month. So thank you, sister, for pointing that out. And I hope that my sneezing ceases very soon, because it still hurts to sneeze. Thank you all for watching. I'll keep you posted. I'll try to put one up, like I said, every week. And so until next time, take care. Hello, everyone. Today is Tuesday, July the 15th. This is 18 days post-op at this point. I'm not wearing the sling right now. The dog wants to come in and say hi. Go on. Go on. Go lay down. Go lay down. Where's your tire? Damn it. Cut. Back it up. Okay, stop. Sit. Stay. So, Stop saying so. Plastic mason jars, dude, these things are awesome. 24 ounces of water you can fit in this thing. Drink 3 or 4 of these a day, you'll be fine.